Medical malpractice, unnecessary surgeries and fake bills exposed. Look, we all know the healthcare system is a mess, right? It's like trying to order a pizza with 17 different toppings and then arguing about the price for 6 hours straight. But here's the thing, it's getting worse. In recent years, medical malpractice has been increasing at an alarming rate. We're talking about a system where your health is increasingly treated as a profit opportunity, not a fundamental human right. Among the most concerning unethical practices are unnecessary surgeries and false medical billing. Now, I know what you're thinking. John, isn't that a bit dramatic? And to that I say, have you seen your medical bills lately? We're talking about a system where a Band-Aid costs $75 and a Tylenol will bankrupt you. But it's not just the cost, it's the principle. These malpractices not only harm patients physically and financially, but also erode trust in the healthcare system. That's what we're going to unpack today, folks. We're going deep into the wild west of unnecessary surgeries and the labyrinthine hellscape of fake medical billing. Buckle up, because things are about to get medically unethical. Unnecessary surgeries, a growing medical scam. Let's talk about unnecessary surgeries, shall we? Because nothing says caring for your well-being like a doctor suggesting you go under the knife when you probably don't need to. It's a tale as old as time, or at least as old as modern medicine. A patient walks into a doctor's office, maybe with a bit of a sniffle or a sore knee, and walks out with a surgery scheduled. Now, I'm not a doctor, but I've seen enough episodes of Grey's Anatomy to know that surgery should be a last resort, not a first-line treatment option. But for some healthcare providers, the allure of a hefty surgical fee can be more tempting than a scalpel left unattended in a surgical tray. Think about it. Non-invasive procedures, physical therapy, lifestyle changes, those things take time, effort, and crucially don't generate the same profit margins as wheeling someone into an operating room. It's a classic case of treating the wallet, not the patient. The worst part? This isn't some fringe conspiracy theory. Studies have shown that a significant percentage of certain surgical procedures are frankly unnecessary. And we're not just talking about minor procedures here, we're talking about heart stents, back surgeries, even hysterectomies, all performed on patients who might have been better served with less invasive and less profitable approaches. This is a systemic problem fueled by perverse incentives and a lack of transparency. And the victims? The patients who are left with unnecessary scars, hefty medical bills, and a lingering sense of betrayal. Unnecessary heart stents and bypass surgeries. All right, folks, let's talk about ticker troubles. Your heart, that magnificent blood-pumping muscle in your chest, deserves all the love and care in the world. But it doesn't need a stent or a bypass every time it skips a beat, which, let's be honest, happens to the best of us, especially when that barista spells your name wrong for the 100th time. The problem is, some cardiologists seem to have mistaken a heart stent for a magic wand and bypass surgery for a routine tune-up. Don't get me wrong, these procedures can be life-saving for patients with serious blockages and heart conditions, but there's a growing concern that they're being overused, performed on patients with minor blockages that could be managed with medication, lifestyle changes, or, just chilling out a bit. Imagine this. You go to the doctor with some mild chest pain, maybe a bit of shortness of breath. Next thing you know, you're on the operating table, getting a stent shoved into your coronary artery. Now, stents aren't exactly harmless. They come with risks, complications, and a hefty price tag. And the kicker. Studies have shown that for many patients with stable heart disease, stents don't actually improve their long-term outcomes compared to medication and lifestyle changes. Bypass surgery, the heavyweight champion of cardiac procedures, is another area of concern. It's a major surgery, folks, not a trip to the dentist. Yet, it's increasingly being performed on patients who might not actually need it. The result? Unnecessary risks, prolonged recovery times, and a mountain of medical bills that would make your heart skip a beat, and not in a good way. Unjustified C-sections, cesarean deliveries. Let's talk about childbirth, shall we? That magical, life-affirming moment when a human being emerges from another human being. Nature's miracle. It's also a multi-billion-dollar industry, and as we've established, where there's money to be made in healthcare, ethical lines tend to get blurry. Enter the C-section or caesarean section, a surgical procedure that's become increasingly common in recent decades. Now, don't get me wrong, C-sections are absolutely necessary in certain situations. They can be life-saving for both mother and baby when complications arise during labor, but here's the rub: C-sections are also more expensive than vaginal births, and they're often scheduled in advance, making them more convenient for hospitals and doctors. See where I'm going with this? In a system driven by profit, the temptation to push for a C-section, even when it might not be medically necessary, can be overwhelming. Suddenly, perfectly healthy women with uncomplicated pregnancies are being told they need to be cut open because their baby is too big or their pelvis is too small. The problem is C-sections are not without risks. They're major abdominal surgeries with longer recovery times, increased risk of infection, and higher rates of complications for future pregnancies. And for what? Convenience? Profit margins? The World Health Organization recommends that C-section rates should be around 10 to 15%. In some countries, they're pushing 50%. That's not progress, folks. That's a business model masquerading as healthcare. Chapter 4. The joys of aging. The creaky knees, the achy hips, the constant reminder that our bodies are in fact not invincible temples, but rather finely tuned machines slowly succumbing to the relentless march of time. But hey, at least we have modern medicine to help us stay spry and mobile, right? Well, that's the idea anyway. But when it comes to joint replacements, particularly knee and hip replacements, it seems like some doctors are a little too eager to whip out the bone saw and start replacing perfectly good joints with shiny new prosthetics. Look, I get it. Joint pain is debilitating. It can make even the simplest tasks feel like an Olympic event. And for some people, joint replacement surgery can be a life changer, relieving pain and restoring mobility. But it's a major surgery with risks, complications, and a lengthy recovery period. The problem is many people who are told they need a knee or hip replacement could actually find relief through less invasive options like physical therapy, weight loss, medication, or even just a good pair of orthotics. But those options take time, effort, and, let's be honest, don't generate the same kind of revenue as a full-blown joint replacement. So what happens? People who might have been able to manage their joint pain with conservative treatment end up going under the knife, risking infection, complications, and a whole lot of unnecessary pain and suffering. All because the medical-industrial complex decided their joints were more profitable as spare parts than as functioning parts of their bodies. Chapter 5. Let's talk about kids and tonsils, shall we? Those little fleshy pads in the back of the throat that seem to exist solely to get infected and make life miserable for children and parents alike. For decades, tonsillectomy, the surgical removal of the tonsils, was a rite of passage for children. It was almost as if pediatricians had a quota to fill, whipping out tonsils with the same casualness as one might collect baseball cards. Now, tonsillectomies are still performed, but the good news is that they're much less common than they used to be. The bad news is that many of these surgeries are still, you guessed it, unnecessary. See, tonsils aren't just useless lumps of flesh hanging out in the back of your throat. They actually serve a purpose. They're part of the immune system, helping to fight off infections. So, removing them should be a last resort, not a first-line treatment option. But here's the thing. Tonsillitis, the inflammation of the tonsils, is incredibly common in children. It's usually caused by a virus, and most cases resolve on their own with rest, fluids, and maybe a little TLC from mom or dad. But some doctors, either out of habit, convenience, or, dare I say, financial incentive, are still quick to recommend tonsillectomy for children who might not actually need it. They might cite recurring sore throats, difficulty swallowing, or even snoring as justification for surgery, but the truth is many of these cases could be managed with watchful waiting, antibiotics if necessary, and maybe a humidifier or two. Instead, children are subjected to surgery, anesthesia, and all the risks and complications that come with it. Chapter 6, let's talk about back pain, shall we? That nagging, debilitating pain that can turn even the simplest tasks into a Herculean effort. It's one of the most common reasons people seek medical attention, and it's also a prime target for unnecessary and often ineffective surgical interventions. Now, back pain is a complex beast. It can be caused by a myriad of factors, from muscle strains and herniated discs to arthritis and spinal stenosis. And for some people, surgery can be a life changer, relieving pain and restoring mobility. But here's the problem. A significant percentage of people who undergo back surgery don't actually need it. They're told they need a discectomy, a laminectomy, a spinal fusion, or some other complex and invasive procedure, when in reality their pain could be effectively managed with less invasive options like physical therapy, chiropractic care, massage, acupuncture, yoga, or even just a good old-fashioned heating pad. But those options take time, effort, and you guessed it, don't generate the same kind of profit as wheeling someone into an operating room and slicing them open. So what happens? People are subjected to unnecessary surgeries with all the risks and complications that entail, only to find that their pain persists or in some cases even worsens. It's a vicious cycle fueled by a combination of factors, including a lack of awareness among patients, aggressive marketing by surgeons and hospitals, and a healthcare system that often prioritizes profit over patients. All right, folks, we've talked about the horrors of unnecessary surgeries, but now let's dive into the equally insidious world of false medical billing, because nothing says get well soon like a bill that reads like the GDP of a small island nation. This is a scam as old as time, or at least as old as double-entry bookkeeping. Inflated charges, phantom fees, and creative coding. It's enough to make your head spin faster than a centrifuge in a medical lab. You see, medical billing is a complicated beast, intentionally so. It's a labyrinthine system of codes, modifiers, and obscure terminology designed to confuse and confound even the most financially savvy among us. And this complexity creates ample opportunity for unscrupulous providers to take advantage of the system and pad their bottom lines at the expense of unsuspecting patients. Here's how it works. You go to the hospital, maybe for a sprained ankle or a bout of the flu. You get poked, prodded, and scanned within an inch of your life. You're given a hospital gown that's seen more action than a mosh pit at a Metallica concert. And then, a few weeks later, the bill arrives. You open it, bracing yourself for the financial blow, but nothing could have prepared you for this. There, staring back at you in bold, unforgiving numbers, is a charge for a splenectomy, which, unless you're a vampire hunter, is a procedure you're fairly certain you didn't have. Chapter 8, COVID-19 hospitalization scams. Remember the COVID-19 pandemic? That global health crisis that upended our lives, overwhelmed our healthcare systems, and turned hand sanitizer into liquid gold? Yeah, good times. But as if a deadly virus wasn't bad enough, the pandemic also exposed the dark underbelly of healthcare profiteering, with hospitals and healthcare providers exploiting the crisis for financial gain. It was a perfect storm, really. A surge in hospitalizations, a shortage of resources, and a climate of fear and uncertainty, all ripe for exploitation by unscrupulous actors. Suddenly, hospitals that were once struggling to stay afloat were transformed into cash cows, raking in billions in government funding and insurance reimbursements. And how did they celebrate their newfound wealth? By engaging in some of the most egregious and morally bankrupt billing practices imaginable. Patients were being charged exorbitant fees for everything from COVID-19 tests to ventilators to basic medical supplies. There were reports of hospitals charging thousands of dollars for a single N95 mask, marking up the price of oxygen by as much as 1,700%, and billing patients for COVID-19 treatment even when they were admitted for completely unrelated reasons. It was a free-for-all, a feeding frenzy of greed and opportunism, with patients caught in the crosshairs. The worst part? Much of this fraud and abuse was perfectly legal thanks to loopholes in the system and lax oversight by regulatory agencies. Chapter 9. Billing dead patients. Let's talk about death, shall we? That inevitable journey we all must take when the mortal coil is shed and we shuffle off this mortal plane. It's a time for reflection, remembrance, and, if you're a hospital administrator, apparently one last opportunity to squeeze a few more dollars out of the deceased. You see, in the cold, calculating world of healthcare finance, death is not the end. It's just another billing opportunity. Hospitals and healthcare providers have been caught sending bills to dead patients, charging for services rendered after they've breathed their last. It's a ghoulish practice, preying on grieving families at their most vulnerable. They'll bill for anything. Room and board, medications, even life support, as if the Grim Reaper himself were on a payment plan. The excuses are as creative as they are callous. They'll claim it's a clerical error, a computer glitch, or my personal favorite, that the bill was generated before they had a chance to update their records. Right, because updating your records is clearly at the bottom of your to-do list when someone dies. The truth is, it's all about maximizing revenue, even if it means exploiting the deceased. It's a moral bankruptcy that would make even the most hardened undertaker blush. Chapter 10. Fake cancer treatment costs. All right, folks, let's talk about cancer, that dreaded disease that strikes fear into the hearts of millions. It's a diagnosis that can turn your world upside down, leaving you feeling vulnerable, scared, and desperate for a cure. And in that moment of vulnerability, unscrupulous healthcare providers see dollar signs. Cancer treatment is expensive, no doubt about it. But some hospitals and oncologists are taking advantage of this, charging patients for unnecessary treatments, inflating costs, and even billing for services that were never provided. They prey on the fear and desperation of cancer patients, using scare tactics and misinformation to convince them to undergo aggressive and often unnecessary treatments. Chemotherapy, radiation, surgery, you name it, they'll recommend it, regardless of whether it's the best course of action for the patient. And the worst part, these unethical practices can actually harm patients, exposing them to the debilitating side effects of treatments they don't need, while also draining their finances and robbing them of precious time. It's a betrayal of trust on a fundamental level, exploiting the most vulnerable among us for profit. It's a stain on the medical profession, a reminder that even in the face of unimaginable suffering, greed and opportunism can still prevail. Chapter 11. Fight back against medical malpractice. So there you have it, folks, the ugly truth about unnecessary surgeries and false medical billing. It's a system that's supposed to heal, but too often it seems hell-bent on exploiting. But here's the good news. You're not powerless. The rise of unnecessary surgeries and false medical billing is a serious threat to ethical medical practice and patient well-being. It's up to all of us to fight back, to demand better from our healthcare system, and to hold those who would exploit the sick and vulnerable accountable. Stay informed, ask questions, and don't be afraid to challenge your doctor or hospital. Remember, your health is your most valuable asset. Don't let greed and corruption rob you of it. Governments and regulatory bodies must strictly monitor healthcare institutions to prevent such unethical practices and restore trust in the medical system. The rise of unnecessary surgeries and false medical billing is a serious threat to ethical medical practice and patient well-being. It is crucial for patients to stay informed, ask questions, and demand transparency in medical care. Governments and regulatory bodies must strictly monitor healthcare institutions to prevent such unethical practices and restore trust in the medical system.